discussion is going to be about personal safety measures. Hi, I'm Kathy Getrust, and I'm an instructor in community health. Emergencies are events that call for immediate action. First aid is that immediate care that's given to a person that is in crisis. This crisis may vary from a person who has fainted or a full-blown heart attack. First aid provides that care until additional help arrives. Your responsibility as a caregiver is to stay with the individual, notify the nurse or call for help of another professional, and begin the first aid. Once professional help arrives, you may be asked to stay and assist in some other way. Be sure that you know in your facility what your responsibilities are in an emergency situation. The first emergency that we're going to be talking about is if someone is choking. Choking is when the throat is blocked and air cannot get into the airway. As you know, we human beings cannot go very long without oxygen in our lungs. In this situation, if a person is choking, you must take quick, decisive action. There are many causes of obstruction of someone's airway, but the most common ones are dentures, which may be ill-fitting and fall to the back of the throat and obstruct the airway. It can be from poorly chewed foods. Frequently, people are talking or laughing when they're eating, and that can lodge in someone's throat. Another common cause of obstruction is meat. Generally, the meat is too large a size to be easily swallowed by an individual. Vomiting is also a very dangerous situation. When someone vomits, the material that is vomited may, instead of coming out through the mouth, may go into the lungs instead. This sucking into the lungs is called aspiration. And obviously, if there is material in the lungs, it makes it difficult for oxygen to be in the lungs at the same time. There are two types of obstruction. The first is partial obstruction. With a partial obstruction, the person can speak and is generally coughing vigorously. Maybe that's happened to you, where you feel like something has gone down the wrong way, and you start coughing, and you know that it is uncontrollable, and your body must continue to cough until the obstruction is relieved. Your responsibility in that instance, if the person is able to speak and is coughing vigorously, is do not intervene. Coughing is the most effective way to dislodge material from the lungs. But do stay with the individual. Do not leave them. Provide them with reassurance that you're going to stay with them. We had an instance several years ago in our area. A woman, in fact it was the mother of the bride, was at a reception, and she had a partial obstruction, and she started to cough, and she was coughing, and all the people were watching her. And if that's ever happened to you, you know that it's really a very embarrassing situation, especially being the mother of the bride. So she got up quickly, went to the bathroom, and no one followed her into the bathroom. She was later found dead. The partial obstruction had gone to a full-blown obstruction where no air was allowed into the lungs, and breathing ceased, and she died. This could have been avoided, I'm sure, had someone stayed with her to be sure that she was continuing to cough effectively and that the material in the lungs was removed and the situation was resolved. Complete obstruction is when the person is unable to speak, and if they're breathing at all, it's only a very high-pitched, squeaky kind of wheeze that you might hear. In addition, with a complete obstruction, the person will do what's called a universal distress signal. With that, there's a grasping of the throat, and their mouth is open in an attempt to breathe. The skin can change to a bluish, grayish, or dusky color as well. Now I'd like you to watch what to do in the event someone is choking. This demonstration is called performing abdominal thrusts, also known as the Heimlich maneuver. Ask the person if they're choking. Determine that it is a complete obstruction. Standing behind, slide the arms under the armpits and wrap both arms around the waist. Clench the fist, keeping the thumb straight. Place the fist thumb side in against the abdomen slightly above the navel and below the rib cage. Grasp the clenched fist with the opposite hand. Deliver rapid inward and upward thrusts until the obstruction is relieved, keeping the elbows bent. If the airway is still obstructed, continue this procedure until successful or the victim becomes unconscious. There are instances when the abdominal thrust is not the best procedure. If someone is in a wheelchair, if someone is extremely heavy in weight, or if someone is in their advanced pregnancy, an alternate form needs to be performed. This is called chest thrusts. Now I'd like you to watch a demonstration of performing chest thrusts. Ask the person if they're choking. Determine that it is a complete obstruction. Wrap the arms under the armpits and around the chest. Place the thumb side of the fist in the middle of the breastbone. Grab the fist with the other hand and perform thrusts until the blockage is cleared or the victim becomes unconscious. The remainder of this videotape will discuss a variety of other kind of emergency situations. Please watch as Linda Hout, a first aid and nursing instructor, leads this discussion.
This video will provide you with first aid information needed to care for medical emergencies and common first aid problems experienced by residents.
Bleeding occurs when a blood vessel has been damaged. If bleeding is severe, it may be life-threatening. Being able to control bleeding is an important skill. Fortunately, most of the time bleeding will stop by itself. Remember to always wear gloves when working with blood and body fluids. To control bleeding, use the cleanest absorbable item you have. Some items that work well include towels, hankies, disposable diapers, maxi pads, or mini pads. Always use caution to prevent getting any blood or body fluids on yourself. Gloves will help in this protection. Make sure after you remove gloves that you wash your hands. Gloves are made of latex or vinyl, not steel, and they are not puncture resistant. If you do get blood or body fluids on yourself, wash the area thoroughly with soapy water. Clothing or shoes can be cleaned up with a solution of 10 parts cold water and 1 part bleach. This must be discarded daily. Refer to your facility's policy regarding body fluid cleanup and what disinfectant to use. Remember that even small amounts of blood can look scary to you, the resident, and bystanders. Be sure to check for injuries anytime you see bleeding. Types of bleeding include arterial, venous, and capillary. When an artery has been cut, the blood is red and spurts out every time the heart beats. When a vein has been cut, the blood is dark red and flows steadily. Slight pressure on the wound will help the bleeding to stop. In a wound where a capillary has been cut, blood oozes and is red. The first step to control bleeding is to apply direct pressure. When applying direct pressure, do the following. Put on gloves. Use a clean cloth or pad to cover the wound. Apply firm pressure. If the cloth becomes soaked with blood, place another one on top. Removal of the first cloth will restart the bleeding. The next step to control bleeding, if direct pressure does not seem to be working, is to elevate the extremity. Hold the bandage firmly in place and elevate the extremity slightly. If bleeding continues, it may be necessary to apply pressure over a pressure point. A pressure point is a site where a main artery lies near the surface of the body over a bone. By applying firm pressure of the artery against the bone, bleeding can be diminished. There are 4 pressure point areas. The pressure point for the arms is called the brachial artery. This artery is located in the upper arm between the biceps and the triceps. Take a minute and try to find the brachial artery pressure point on yourself. You will know if you are correct in finding the location because you will feel a pulse there. Put firm pressure on the area. Controlling bleeding for the lower extremity means locating the femoral artery and pressing firmly with the heel of your hand or fingertips. The femoral artery is located in the crease of the groin. Next time you get ready for bed, try to locate the femoral artery on yourself. You will know if your location is correct because you will be able to feel a pulse. An application of a pressure dressing over the bleeding wound may be necessary. Pressure bandages should be applied snugly over the bleeding wound. Always check the fingers for warmth, color, and feeling after you have applied a pressure dressing. The goal is to decrease blood flow, not stop it. To control bleeding, apply direct pressure. Elevate the extremity. Use pressure points. Apply a pressure bandage. Nosebleeds are fairly common and may be caused by an injury to the nose, blowing the nose, or exposure to cold or dry air during the winter months. Nosebleeds are not usually serious. Most nosebleeds can be controlled in 10 minutes. Most residents can pinch their nostrils shut themselves. Wear gloves if you need to assist them in applying pressure. The resident should sit down and lean forward. Pinch nostrils together for 10 minutes. Pinch for an additional 10 minutes if needed. Medical attention should be obtained if the nosebleed does not stop after 20 minutes of pinching pressure. Nosebleeds can also result from a head or neck injury. If you suspect a head or neck injury and the nose is bleeding, do not pinch the nostril shut. Doing so would cause further harm. Heart disease is a leading cause of death for people over the age of 45 in the United States. Although heart attacks may seem to be sudden, most are a result of lifestyle choices that are made every day. Most often called a heart attack, myocardial infarction means the death of a heart muscle. This is most often associated with coronary artery disease. Researchers have identified factors that increase a person's chances of having a heart attack. These factors are called risk factors. Some risk factors can be changed, such as smoking, blood pressure, diabetes, weight gain, while others cannot be changed. For example, having had family members who have had heart disease can increase risk for a heart attack. It is always a good idea to identify your own risk factors and work on changing the ones that you can. The signs and symptoms of a heart attack may vary from a feeling of indigestion to severe crushing chest pain. Many people may deny that they are experiencing a heart attack and sometimes delay seeking medical attention. Signs and symptoms of a heart attack include pain or pressure in the chest, arm, neck, or jaw, difficulty breathing, shortness of breath, pale, cool, or sweaty skin, lightheadedness, weakness, or denial that anything's going wrong, or feeling of impending doom. Remember that not all of these symptoms will occur with every heart attack. If some start, do not delay. Recognizing a heart attack and getting the necessary care at once may prevent a resident from going into cardiac arrest. If any symptoms of a heart attack begin, signal for help and stay with the resident. Monitor breathing and pulse. Keep the resident in a position of comfort, usually sitting unless they are weak. Then lie them on their side. Loosen clothing to ease any difficult breathing. Reassure the resident. If you are trained, be prepared to do CPR. Remember, time is muscle. The longer you wait before calling for assistance, the longer the heart muscle has time to become permanently damaged. Stroke, or brain attack, is a leading cause of death in Americans. A stroke is a blockage or rupture of a blood vessel in the brain. An increased awareness of what it means to have a healthier life can decrease the risk of stroke. Knowledge of risk factors that may lead to a stroke is an important first step. As with a heart attack, risks that can be changed to prevent a stroke may be high blood pressure, heart disease, and smoking. Risk factors that cannot be changed include heredity, age, gender, and race. Do you have any of these risk factors? Signs and symptoms of stroke include sudden weakness or numbness of face, arm, or leg on one side of the body, sudden severe intense headache, loss of speech, speech slurred or incoherent, loss of consciousness, dimness of vision, particularly in one eye, unsteadiness, or a sudden fall, loss of bladder control. Treatment for a stroke requires an immediate signal for help and stay with the resident. Maintaining airway, breathing, and pulse. Make sure to lay resident on their side to keep them from choking on their own saliva. Provide the resident with assurance. When the normal workings of the brain are disrupted by injury, disease, fever, or infection, the electrical activity of the brain becomes irregular. This can cause a loss of body control known as a seizure. If seizures are chronic, they are usually controlled by medication. 3 general types of seizures include petit mal or absence, where we see brief blackouts, inattentiveness, or staring. Psychomotor seizures present themselves with blank stares, random activity, mumbling, picking at self or clothing, or the resident is dazed or confused. In grand mal seizures, we see rigidity, muscle jerking, shallow breathing, a sudden cry or moan. These usually last 2 to 5 minutes. It may be frightening to witness someone having a seizure, but remember that a seizure may only last for a few seconds to minutes, and then the resident recovers fairly quickly. Seizures are not transmitted from person to person. Treatment for a seizure includes making sure that the resident does not injure themselves by helping them to the ground. Clear the area of any objects that may cause injury. Do not hold them down or put anything in their mouths. Monitor their airway.
Signal for help, stay with the resident, and provide reassurance.
Fainting may occur when there is an insufficient supply of blood to the brain for a short period of time. A fainting spell may be prevented by having the resident lie down or sit down with their head level with their knees if they complain of feeling weak or dizzy. Treatment for fainting includes bringing the resident safely to the floor, loosen any tight clothing, make sure the resident is breathing. If the resident doesn't regain consciousness within several minutes,
Signal for help, stay with the resident, and provide reassurance.
exposure to extreme heat or cold may make a resident seriously ill. Illnesses caused by overexposure to heat include heat cramps, heat exhaustion, and heat stroke. Heat cramps are the body's attempt to signal that the heat is not being tolerated very well. Heat cramps are painful muscle spasms that usually occur in the legs and abdomen. Heat exhaustion is a more severe condition than heat cramps. Heat stroke is the most severe heat emergency and occurs when the signs of heat exhaustion are ignored. During a heat stroke, the body can no longer use its heat reduction mechanisms, such as sweating. The body's temperature goes to very high levels. This is a life-threatening emergency. Symptoms of heat cramps include normal or below body temperature, cool, moist, pale skin, heavy sweating, headache, nausea. Treatment of heat cramps includes removing the resident from the heat. Give cool water, lightly stretch any muscles, and gently massage the area. Signs and symptoms of heat exhaustion include normal or below normal body temperature, cool, moist, pale skin, dizziness and weakness, heavy sweating, headache, nausea. Treatment of heat exhaustion includes having the resident rest in a cool place. Remove or loosen clothing. If not nauseated, give fluids. Observe for shock. Elevate legs. Signs and symptoms of heat stroke includes fast, shallow breathing. The resident may be unconscious. The skin may be hot or red. There will be no sweating. Pupils may be small, a weak pulse, and a high body temperature. Treatment of heat stroke includes checking breathing and pulse. Cool the resident immediately.
Signal for help, stay with the resident, and provide reassurance.
Frostbite and hypothermia are two types of cold emergencies. In hypothermia, the entire body cools because of its failure to stay warm. If not cared for, the person may die. Alcohol alters the body's response to cold, therefore the person may become hypothermic more easily. Frostbite is the injury to the tissues and skin which is caused by direct contact with a cold object or exposure of the body to cold air. Severity depends on the air temperature, length of exposure, and the wind. Areas most susceptible are the ears, nose, cheeks, and fingers. Severe frostbite may result in loss of fingers, hands, feet, and toes. Signs and symptoms of hypothermia include shivering in the early stage, coordination problems, muscle stiffness, numbness, and confusion. Treatment of hypothermia includes removing the resident from the cold. Remove wet clothing and cover with a dry blanket. Check breathing and pulse.
Signal for help.
Signs and symptoms of frostbite include the skin is red and eventually white. Area may hurt initially, but may become numb. Treatment of frostbite includes removing the resident from the cold, rewarming the area slowly. Remember not to rub the affected area. Do not use blow dryers. Do not break any blisters that appear.
Signal for help. In this video, you've learned how to care for first aid emergencies. Remember that your timely response to any emergency will make a difference. Thank you.